Catholic Health is a 4-hospital system in Western New York. We employ about 8,500 people, and we provide primary care services, long-term care services, acute care services to all of Western New York. Our main project with Terakai was our voice over IP implementation. So before that, we had mostly old PBX systems that were split across our 4 different campuses, 4 different systems, all of which were not supported anymore. We had to reboot our phone systems about 4 times a day to keep them stable. So as you can understand, a hospital lifeline is its phone systems. People call the hospital all the time. They call the emergency department. They call the labs for their lab services. So we had to really make sure that our telecommunication services were spot on and 100% available. One of the major things that we've installed is instant messaging across the system, and that was a brand new operating environment for our employees. Online voicemail was a very important part. 4 to 5-digit dialing is an important part. Just being able to pick up a phone and move it from one place to the other place without having to call a telecom guy to program it up was also an important piece. Having a strong network component, horizontal network component with Terakai, and a strong voice over IP component with Terakai, we're able to reach out and bring in all of our different lab systems, our lab environments, our long-term care environments, all in the same functionality from a phone perspective. In our Buffalo Mercy emergency department, we use Cisco wireless phones that are integrated with our nurse call system, and the clinicians get paged when somebody presses a button, needs water or whatnot. Clinical lab values also go to these wireless phones, and they use them as they walk around the facility to make sure that they can be more available to the patients. As opposed to sitting at the nurse station, they're now out on the floor more often, closer to the patient, provides the patient with much better service and communication with their caregivers. We use Jabber continuously to make sure that we stay on top of communicating with each other across, no matter where we are, across the system. Even though we are just a regional system, it saved a lot of driving time and made sure that we stayed in contact with each other and are able to communicate in a way that maybe wasn't facilitated so easily by a telephone call or an email message. Once we have the communication systems out to the clinical areas like Jabber, we feel that is going to change a huge amount of the way that they do business at the bedside. Once the nurses can Jabber not only on their PCs but on their phones, we feel that's going to be a great opportunity for them to, again, spend more time at the bedside. It's all about getting the clinicians right next to the bedside and not at the nurse's station or not at doctor's waiting room. Well, collaboration is enabling the IT department to let our clinicians do what they need to do without getting bogged down by technology that doesn't work in their benefit. So we recently moved to WebEx, and that's changed the way that we've done training. It's changed the way that we've done communication. The ability to integrate video and voice and sharing documents has really modified the way that we've done business as an organization. Terakai helped us with the initial design, architecture of the solution. They also helped us with the installation of the solution and training and overall project management for the implementation. We knew that we had a partner that we could rely on that had been there and done that before, and that was a real comfort for us to know that they had the experience in the implementation that we didn't have as an organization. Only having done it once, we didn't want to make mistakes. We wanted to be able to leverage their experience in having done dozens of installs prior to ours. Our first cutover at Buffalo Mercy Hospital for voice over IP went extremely smoothly. We did it in one night. And we don't feel that we could have done that and had that minimal impact to our end users unless we had used Terakai's services to assist us with training of end users, with the deployment of the phones, and with the overall project management that we receive from them. We do have staff on board that understand the VoIP system, but they don't have the experience with the installations that Terakai's engineers have, so it was very vital to us to be able to leverage that as part of our implementation and ongoing support.